Well, I'm a consultant physician, so unlike all the other physicians in healthcare, I try and care about patients. But then in 1984, I became aware of this discipline called Health Information Management, or Health Informatics. It is the timely, reliable, complete information at the patient care interface. We know it works, we know it reduces errors, we know it improves outcomes, we know it facilitates research, it improves epidemiology and reduces the cost of healthcare, reduces errors, produces better patient outcomes. One model of that system has been implemented here, but more importantly, we took that knowledge and implemented it in Africa, where there are no resources, no reliable electricity, no paper, the greatest epidemic in the history of mankind, 45 million people with HIV/AIDS, and these people had never seen a computer before. By involving them in the process, the concept of teaching them how to fish rather than just feed them, they now run the largest, what is defined as electronic record system in the world for the management of HIV in developing nations. And when we went there, we knew there was a 14% prevalence of HIV. In this small electronic record system, after 2 years, we had 60,000 patient visits. The project is not just for cumulative data and outputs in that, which is a byproduct of the patient care process. So, in fact, we have this saying, a lot of people see medicine as a business. For clinical informaticians, we see our business is clinical medicine. And while you try to build a system for healthcare as a business, these systems are going to fail, and we know that's been reproduced with losses of millions and millions and millions of dollars throughout the world. But those systems built for the patient care process, where all other data comes as a byproduct of that, they have been shown to improve the care process. It's so fundamental to making my healthcare process better. If I have information at my fingertips, timely, reliable and complete, that I can access 24 hours a day, 7 days a week, wherever I am in the world, that's what's important. But more importantly, the most important driver of this has to be the patient. We assume patients don't have the knowledge and information management we have. Well, what do you do to the diabetic who takes insulin and lives on their own and is semi-blind and got arthritis? Do we live in their house and adjust their insulin every day, 3 times a day? No. Give the patient the information and they manage it beautifully, It's quite inspirational. In fact, I did a small trial in Launceston Hospital where 17% of my patients who email their sugars are over 65 years of age. And in a place like Tasmania, this is ideal because 5 minutes out of Launceston, you're in the bush. So if you're 80 kilometres away and you need an appointment with me, and you're old, or 60 or 70, or just getting there, these patients email. We do it real time. Patient carries their record with them.